One of the responsibilities of the office as Chief Health and Medical Officer, one of the major responsibilities, is oversight of any medical care within the agency, whether it's the care of the astronauts or the workforce through our occupational health clinics at each of the centers. And so within the last 10 years, we developed what's called a medical quality assurance set of policies. Medical quality assurance is something that exists in any medical care setting. And essentially what it refers to is the policies that oversee the credentialing of the medical professionals, the doctors and nurses who are going to be seeing patients, as well as processes for if something were to go wrong, if you had a medical mishap, a process for investigating that mishap, and or if there ever was an issue with a provider or a doctor or nurse in terms of their performance and or any issues that could affect their performance. And so Dr. Williams, the NASA Chief Health and Medical Officer, wanted to have in place, there never had been any real policies at NASA governing and defining the requirements for medical quality assurance within the agency. And so within the last 10 years, we put together a policy document as well as policy requirements that define what we expect from our medical professionals, how they'll interact with the patients, and also developing the processes the agency would use if we ever did have a medical mishap or there ever were an issue with a medical provider in the agency in terms of their performance. But again, our medical quality assurance is based on the standard medical quality assurance that you would find in any hospital or any healthcare environment. And we actually, as we put our policies together, we looked at, for example, what the VA does at their hospital. We also looked at what Department of Defense does in the defense hospitals and things like that. But that was sort of a missing piece in our policy oversight, that there wasn't anything formalized and written down in terms of what you needed to do to maintain your medical quality assurance. So getting our quality assurance policies in place, and I think those were put in place, I think in 2008, that was a big step for really strengthening the agency's health and medical infrastructure.